Good morning, everyone. The NEET PG warriors, the future toppers, and great consultants in whose hands the future generation of Indian public health is dependent on. Hope you all have started a great day. 24th of July, the last week of July. So still we have August, September, October, November, December. Oh my God, 20 weeks of time and only 19 subjects to master. Achievable? Achievable. Absolutely achievable. Please inform your friends to join the game. Good to see Dr. Shashi Verma. And yes. So, starting this game, I'm able to see some English subtitles also. Very good. YouTube is becoming very advanced nowadays. Yes. Chalo, 27 online. I'm just waiting for another 3 to 4 members to join to make it 30 players so that we can make a great start. Shankar Prasad, good morning. And we have Shashi Verma. So you all guys can join the quiz. First, be part of our WhatsApp group. I'm pasting here the link to our WhatsApp group. Please be part of it. Share it to your friends also to join the quiz. Every day we have 11 a.m., 3 p.m., 7 p.m., 9 p.m. and Midnight Masala, 12 p.m. 5 quiz tournaments on 5 different subjects of NEET PG. Be part of it, compete with the whole India, get yourself inspired. If you become the topper, you get 40,000 rupees worth of online MBBS.com video library subscription. If you are not also, you are learning few points, you are waking up with greater inspiration to start revising those concepts, right? So, doctor, let's make the start. Question number 1. Motorcyclist fracture. What is the answer? What is a motorcyclist fracture is my question to all of you. Good to see 25 online punching your answers. Great. It is the separation of the suture between anterior and posterior half of the skull is what you need to remember. Wow, we suddenly have 33 online. Very good, very good, very good. So we will be posting the quiz link at least half an hour before the start of the quiz only. So you can actually log yourself in and wait for the time to join, right? Even if you are in hospital, anywhere, you can still join. Now, the next question. Question number 2. These are all true about whiplash injury. Whiplash injury. Which part of the spine is most commonly involved? Is the whiplash injury not common or a common one? Will there be any paresthesia, chronic pain? Oh, most of you thought option E. No. So, lumbar spine is not commonly involved. It is the cervical spine most commonly involved in whiplash injury is what you need to remember. That brings Carlson onto the top. Avijit, Harsha, Suhu, Sivashankari. Very good. Now, doctor. Cervical spine is commonest affected area in whiplash injury. So, if you have done this question wrong, immediately what you need to do is you need to go back to the onlineMBBS.com video library and take a chance to do the revision. Now, you have been shown a test. So, in that test, what is tested? 14 of you correctly answered. It is Thomas test. Thomas test is basically done to look for the fixed flexion deformity of the hip, is what you need to remember. That's great. 39 of you. Avijit is on the top. Shiva Shankari, Shivananda Lahari is in the position 4. Very good, Shiva Shankari. Now, this is the Thomas test. Now, question number 4. Trendelenburg test will be positive. In what situation? In what situation? Is it L4, L5 intervertebral disc prolapse, or L5S1, or synovitis of the hip? Where do you see positive? That is beautiful, oh, Italia. 9 of you are correct. Absolutely, doctor. So that keeps the Coulson onto the top. Oh, Shiva Shankari, you missed it. No worries. So L4, L5 disc prolapse typically compresses the L5 nerve root. It is the L5 nerve root which supplies the gluteus medius and minimus, which is responsible for Trendelenburg's test positivity, is what you need to remember. Very good. Question number 5. The most common type of hip fracture in childhood. Originally, orthopedics got its name because fractures are common in pediatric age group. Yes. The most common type of hip fracture in childhood. Whoa, only 4 of you answered correctly. You know, while setting up the questions, I will be thinking, what will be the most common wrong answer? Is this question going to be answered by majority or minority? I'll make a guess while picking up the questions, right? I know. So, totally, there are 1200 MCQs in orthopedics, doctor. If you take AIMS, All India, PGI, JIPMA, and NEET PG, FMGE, DNB question bank. If you remove the things, unique questions are 1200. Divided into 35 to 40 most important topics. So we have developed a 40-hour video lectures which are available in the onlineMBBS.com video library. If you invest 40 hours of your time, I can guarantee you, doctor, you will score 15 out of 15 marks in orthopedics. Generally 10 to 15 marks will come. You're sure to score, but you need to give 40 hours of your time. So, doctor, question number 6. Good to see 42 online. The fracture, please expand the fracture shown in the figure. First of all, kaun sa fracture head diagnosis karna, Dr. Babu? So, what is the best way to treat it? What is the best treatment? Good to see Jancy James, Ashk Ahmed, Sashi Verma, Shankar Prasad. Please join the WhatsApp group, doctor. If you join our WhatsApp group, we will give you fun of preparation for entrance and also the quiz link before the quiz starts. Dynamic hip screw is the answer. So, doctor, that keeps really Coulson rocking on the top. Coulson was already our topper. Harsha was also a topper. Yes. Now, doctor, It is a trochanteric fracture of the femur. Dynamic hip screw plate is the implant of choice for trochanteric fracture, and nowadays even proximal femoral nail is also commonly used. Right? Now, the next question. Question 7. A patient presented after road traffic accident with this attitude, which you are seeing. What is the most possible diagnosis? So, what is the most possible diagnosis? Yup, it is anterior dislocation of the hip. So definitely attitude wala question repeatedly asked. I am wondering how Carlson did this question wrong. But Harry, Oddity, Mauni, Saru, Shiva Shankari also did correctly. So anterior dislocations occur whenever the hip is externally rotated and abducted. Externally rotated and abducted. And the degree of the flexion at the time of injury is a determining factor where is the femoral head is going to stay. So according to the position assumed by the femoral head, the anti-dislocations are being divided into the pubic, obturator, perineal, that is a classification. And lengthening of the limb is a feature of the anterior dislocations is what you need to remember. Question number 8. Very good. Vijay Bhargava Pasupuleti. Hey Vijay, please use this WhatsApp joining link, get into our WhatsApp group, and you will get the quiz link and you can play. Okay? So, what is the characteristic posture shown to you was that of the posterior dislocation of the hip. This is an easy question actually. Most of you will correctly answer. Harsha is on the top. Flexion, adduction, internal rotation, Fadir and Febex, all of you know very well. Now, question number 9. In upper 1/3 femoral shaft fracture, the proximal segment becomes displaced. What is the position it will align itself after displacement? Beautiful question. Great. Flexion, abduction, external rotation is what you need to remember. So these are all very standard questions, doctor. Nothing novel about them. कल भी, आज भी, कल भी, परसों भी और कुछ बरसों के बाद भी. ये सर्जिकल सब्जेक्ट्स जो होते हैं, almost they remain constant like that only. 20 years back when we took entrance exam or currently you are taking entrance exam, stories same. Okay. Now. Question number 10. Maximum shortening of the lower limb. Where do you see? Where do you see? Is it fracture shaft of femur? Fracture neck of femur? Fracture intertrochanteric femur? Oh my God. Third and fourth options got clubbed. But first option is the correct option. Fracture shaft of the femur is what you need to remember. So many times this question was asked in the NEET PG, FMG and all the exams. Pravalika, oddity, correctly answered. Harsha missed it. So, if you look at the lower limb fractures, the maximum shortening, you should remember the order. The most shortened are posterior dislocation of hip, more than fracture shaft of femur, more than fracture subtrochanteric femur, more than intertrochanteric, and least Shortening is in the fractured neck of the femur. Please don't forget this order. Ek football le lo. Now, question number 11. For the ankle injury, what is the most common mechanism? Is it supination, supination adduction, or is it supex, supination external rotation, or is it pronation abduction or pronation external rotation? One of the favorite questions of examiner. 9 of you correctly answered. Supination external rotation. So you should read everything about ankle injury, doctor. Favorite question of examiner. What is the classification system of ankle injury? What is the Salter-Harris classification? Right? How do you treat ankle injuries? So if you have done this question wrong, you have to run and quickly catch up with onlinembbs.com video library and do a revision. And shortly, we are having Dr. Ravi Kumar Sir, excellent orthopedic teacher. So from next week onwards, his live online interactive sessions are going to start, but they are going to be privately held. In about 15 hours, Dr. Ravi Kumar Sir is going to give a quick revision for FMG and NEET PG crash preparation in the subject of orthopedics. It costs you 1,500 rupees to join the course. So please call our helpline 9000868 See, doctor, there are two things. One is video library like us, onlinembbs.com video library, which is a video archived of an online live session like this. And the other part is live online interactive. But they are more interesting, live online interactive, because teacher भी पढ़ के आ रहे और आप भी पढ़ के जा रहे और दोनों मिल के पढ़ रहे है ना. तो definitely onlinembbs.com video library will be your backbone for preparation. We are pulling in a lot of teachers onto our platform so that our students who are attending the quiz tournaments get an exposure to them, and they can be able to join the live online rapid review sessions by our faculty. Okay, so Dr. Harita is also shortly starting next week onwards a 15-hour session of a rapid review of pathology live online interactive privately held. Okay, so now doctor, the next question. So Carlson missed it, but Saru is right. So supination adduction injury, avulsion of the fibular tip, and supination external rotation is most common, is what you need to remember. Now, ankle sprain ligament involved is, in the ankle sprain, what is the ligament which is most commonly involved? Yes, doc. Most commonly involved. Wow, that's great. Only 6 of you are right. Anterior talofibular ligament is what you need to remember. That keeps Carlson on the top. Great. Now, question number 13. March fracture. What does it involve? March fracture. First and second, or second and third, or third and fourth. Come on. So a lot of times, मुझे मालूम है kind of feeling will come. But do you precisely know or not is what examiner want. 16 of you correctly answered. Now, Carlson is on the top, followed by Harsha. Question number 14. Runner's fracture. What does it involve? What does it involve? In the tibia, fibula, metatarsal talus, what involves runner's fracture? All these acronymous names of the fractures is always grilling in the exam in the orthopedics. Great. It is the fibula, which is the runner's fracture. Only 7 of you rightly answered. Oh my God. Only P is correct. Question number 15. One of these fracture requires plaster of Paris cast in an equinus position. Plaster of Paris in equinus position. Come on, doctor, देख लेंगे कौन कितना पढ़ रहा है आजकल ऑर्थोपेडिक्स को. बढ़िया. Fracture talus. Okay, so once more, if you have done wrong, don't lose your heart. Just go back to the onlineMBBS.com video library and please do a revision. You have 1 lakh PowerPoint slides in that. So that makes B to come to the top more than the P. Oh. Now, question number 16. You are seeing one fracture. Please expand. Please expand the image on the smartphone. The most common complication of this fracture. First of all, वो कौन सा fracture है समझ में आना? बेटा राहुल, correctly answer करो. Yes. What is that fracture first of all? It is the fracture of the talus. Talus is the key bone. And osteoarthritis of the subtalar joint is the most common complication, is what you need to remember. That gives Avijit extra points. So fracture talus, most common complication is osteoarthritis of subtalar joint. आप क्या करना? ये क्विज खत्म करने के बाद आपके दोस्तों को रीडिंग रूम में जरा झलक दिखलाना. झलक दिखलाना. You have to give one small slip के ऊपर लिख के दे दो. चलो रे आंसर करो बोल के. If he does wrong, get happy. If he does right, congratulate him. Right? So question number 17. भैया ये फ्रैक्चर को देख के बताओ, इस फ्रैक्चर को क्या फ्रैक्चर बोलोगे? Is it pot? Is it bumper? Is it content? Is it pillow? Come on. What is this fracture? It is the Potts fracture is what you need to remember. Excellent. अच्छा भैया ये पार्ट कैसे बन गया? पार्ट बोले तो क्या है? Bimalleolar fracture, medial and lateral malleolus दोनों में दिक्कत हो गया. बाबूजी उसको बोलते हैं Potts fracture. Very good. Question number 18. It is not trimalleolar, Surya Pradeep. It is bimalleolar only. So what is this fracture? अब भी इसको बोलो सूर्या. सूर्या देख के बोलो ये कौन सा फ्रैक्चर है? Yes, it is Cotton's fracture. Cotton's fracture. बढ़िया. That brings Colson to the top. So trimalleolar ankle fracture को कहते हैं Cotton, जिसमें medial, lateral, posterior malleolar, all the three become involved. Is what you need to remember. The last question going to decide who is going to get the 40,000 rupees of onlineMBBS.com video library. आप देख रहे हैं कुछ, जरा एक्सपेंड करके देखो वो क्या है. इसको क्या बोलते हैं? What do you call this? What do you call this? Yeah, this is called toddler's fracture is what you need to Remember. So, doctor, you should know that. Very good. Colson is on the top. So, typically in infants, you get this toddler's fracture where the lower end of the tibia shows it. Colson, Jindabad. This is the second time or maybe third time. Colson is our serial killer. Maybe Colson can give the 40,000 rupees subscription donated to his girlfriend, his roommate's girlfriend, or his boyfriend's girlfriend. Anything is okay, right? So once more, doctor, please don't forget. Our day should start with good inspiration. To fall is the beginning of that inspiration. To do mistakes is the beginning of that inspiration to study orthopedics. Once more at 3 p.m. we are all meeting for the quiz tournament, and every day 11 a.m., 3 p.m., 7 p.m., 9 p.m. and midnight masala 12 p.m. Please don't miss it, and also spread this to all your friends, and let's make it viral with almost all 10,000 students joining one day. That's the hope. Yeah. So enjoy a great day. We will all meet up at 3 p.m. in the afternoon. Thank you.